It's important because people with functional disorders often experience poor communication in their clinical encounters. They sometimes feel that the clinician isn't listening to them, or that they are misunderstood, or sometimes just not believed. Together, these have an effect of creating a stigma that these people experience. And this is repeated. It doesn't just happen once, it happens often. And that leads to a cumulative effect that makes people less likely to expect good from their health encounters, and sometimes less likely even to make appointments to be seen. I think there's three reasons. The first one is a lack of knowledge that professionals have. That's a lack of knowledge about functional disorders generally, but also about how to communicate them. I think that needs to change and can change because the recent neuroscientific developments in the way we understand symptoms make that really useful. The next is the focus of healthcare at the moment, which is on recognizing and treating serious disease. So symptoms are seen as an indicator of something serious that might be wrong. When that problem's ruled out, the symptoms are dismissed. And that means the patient is dismissed, even though the symptoms continue. The third one is just the capacity in the healthcare system to do this well. It does take skill, which takes training, and it does take time. But what's important from the research that we've been doing is that investing that skill and that time to communicate well with patients can have long-term rewards. In our recent work, we've looked at ways of doing this better. And we've come up with a framework that you can use in healthcare consultations, whether they're short or long, that has 4 key components that matter to people with functional disorders: recognition, explanation, action, and learning. The recognition is about recognizing the person and their experience of illness and symptoms, and sometimes the way the healthcare system has dealt with them. It's making it clear that you understand them and validating their experience and the legitimacy of the problem that they have. The explanation seeks to make sense of the symptoms, and he often draws on the recent developments in neuroscience. Actions are ways of then using that explanation to manage symptoms and adapt to them. And the learning is a process of collaboration between the practitioner and the patient to co-create the best personal meaning and to work out what's the best way of putting it into practice for them and knowing how it's working. So the idea of the explanations is that they're ways of taking our knowledge from neuroscience and making sense of symptoms in a way that the person finds useful. So for instance, someone with a functional gastrointestinal disorder, we can explain that in terms of the tuning or the configuration of the many different nerves that automatically affect the digestive system and the way the stomach or the intestine works. If those are out of tune, if they're out of balance, symptoms arise. And it's helpful because it leads to thinking about how we get them back into balance. We can think of fatigue as the brain applying a handbrake, a way of saying, don't expend energy. Now, it may be that that is there and on for a good reason. Sometimes it seems like it's been put on for a good reason and then it's got stuck. But again, it's how do we then work to get that handbrake off? And finally, if we think about things like functional neurological disorders, we can think of weakness as the body getting its signals crossed, and instead of saying go, it says stop. These are all based on the science, translated into ordinary language, and useful in terms of, okay, so how do we work out how to fix this for you? So just remember, recognition, explanation, action, learning. Keep it real.